So is there any reason, Dr. Wallen, that somebody couldn't have an implant if they failed all the other treatments? Is there any reason they have to live with erectile dysfunction, or could they be a candidate for an implant, or why not?
Well, I mean, there's certainly some counterindications. I mean, obviously there's allergies to the materials in these devices, very rare. Seen it maybe only in 1 or 2 patients that I've seen, and I don't think the literature would suggest that it's the incidence of that is much higher. By and large, remember, to some extent, if you've had radiation therapy to the pelvis, if you've had surgery to the pelvis, all these different things that could potentially be an option, or if your heart or your lungs are not strong enough to undergo a procedure, then those could be reasons you may not necessarily be a candidate. But otherwise, it's basically done through a small little incision like this. So even for a diabetic person, it could be done through a number of different incisions, but a lot of times it's a small little incision above the penis. Even for a diabetic person, and if you're concerned about wound healing, whether you're on immunotherapy drugs or whether you're diabetic or other things, that small little wound should heal even in that nature. So by and large, most people would be a candidate. Certainly if you have severe COPD and you just can't tolerate it. One of my old mentors used to always say, listen, that guy couldn't even tolerate a haircut, let alone a surgery. So from that standpoint, if you can't tolerate a haircut, then we probably shouldn't be doing a surgery on you. But, unless your heart or lungs are that bad, or, for some reason, remember, to some extent, if you've had previous radiation to the prostate, a lot of times, unfortunately, the penis will be involved in that field, depending on if you've had external beam or seed therapy. We're specifically kind of more mentioning about external beam therapy. And that can kind of cause some scar tissue and certainly can cause some problems or potential more difficulties with doing the surgery, but that doesn't mean that it can't be done. So from that standpoint, pretty much anybody could be a candidate. I think a lot of times, unfortunately, it's a little bit psychological, right? And so I commonly hear from guys, hey, I'm ready to do anything, but I don't want surgery, or I don't want a procedure done, or what have you. But quite honestly, it's not just about an erection. And that's where I think, trying to keep it classy, to some extent, it's intimacy, right? And so that's a quality of life component that, to a large degree can actually kind of restore relationships if they're present and they're corrected, and essentially kind of bring that vitality and youth back. Again, that's where I love regenerative medicine as well. And, obviously if we could all essentially kind of take an injection or an IV or whatever and fix whatever problem we have and be exactly like we were when we were 20, of course, we're all going to sign up for that. But in some cases, that's just not the possibility. And so that's where I think you have to be open to the options that are out there that could be effective for you. Because quite honestly, again, folks always laugh about it, but these penile implants, they have high satisfaction. I mean, with the millions of guys that have been implanted now, patient satisfaction is 95 plus, partner satisfaction is 90 plus, and they're actually very durable. I mean, they last upwards of 15 years, 60 to 80% of guys are still functional 15 years later. So from that standpoint, I mean, you could potentially have one procedure done. And again, if you ask me about it, and I always tell my patients this because I try to tell people exactly what I would want for myself with the knowledge that I have, or my family with the knowledge that I have. And I always tell people I'd much rather get an implant than be poking my penis with a needle every time I want to have sex. Because really, quite honestly, that's not very fun when you think about, having intercourse or having activities have to be jabbing yourself with a needle down there. So, it
kind of ruins intimacy, like you're talking about,
right,
really.
Right. It's a huge problem. If I mean, I guess there's a certain amount of pain some people like, but that's not a pain that I really want. Right? I always kind of joke around with my guys, and I'm just like, listen, I've never ever would I have ever wished that I would have to poke myself in the penis with a needle, throughout old age. So,
well, and I did just on these penile implants, I did talk to a patient, and she had a partner who had prostatectomy.
Right.
So he needed an implant. You know, he tried all the other avenues and he needed an implant.
Right.
And this is what she told me. And I think I told you the story, and she might be making some of this up. I don't know. But they have these and she could control it by Bluetooth. I'm just, that is super cool. And I could see that being, you know, actually kind of a part of foreplay. So, and that's kind of how she used it. So, you know, technology is wonderful these days. And, you know, we need to take advantage of that.